DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, we're glad you decided to watch Doc Talk today. We're going to have a great show. We have Dr. Blaine Johnson from Texas Tech. We're going to talk about something we all dread, and that's Pinkeye. Stay tuned. It's going to be a great show. We're coming to you from Amarillo, Texas.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to Doc Talk. I'm Dr. Dan Thompson, and I'm here with my friend and colleague, Dr. Blaine Johnson. We're in Amarillo, Texas, where Dr. Johnson serves as a veterinarian and an assistant professor in bovine medicine and production medicine here at Texas Tech's University School of Veterinary Medicine. We're going to talk about Pinkeye.
Yes.
And just talk a little bit about, what the heck, why did we get Pinkeye?
Why do we get Pinkeye? That is a good question. And it's one of those, it's getting to that time of year and it's a pain in the butt to deal with.
Yeah.
Unless there's no good way around it. And why do we get it? It's because we have eyes. The cattle have eyes, and they're out in an environment where there's things out in the environment that are all potential causes of causing erosions that become a problematic lesion, and this lesion festers and becomes infected. And then this infected lesion on the eye becomes extremely painful, and these animals are not eating, they're not doing well. And you can imagine if you've ever had anything stuck in your eye, or you've had an abrasion to your eye of some sort, that it is a very painful part of the body to injure. And these animals are trying to go around, and if you've ever had an ulcer on your eye for whatever reason, sunlight is extremely painful on that. And they're out in the open, they're at constant sunlight, they're cattle, they're grazing. Yep. So it's constantly that they're in this squinting eye pain, and it becomes very problematic. And if you look at some of the research out there, it's very costly too. Not just from costing to treat the disease, but the potential back-end costs that we see with that. If there's defects on the eye of calves, when those calves get sold in the fall, that can have a potential deficit to your bottom line. If you have cows that are constantly in pain from Pinkeye, they could potentially not get pregnant, or worse yet, abort the current pregnancy they have in the spring or early summer time frame. Or if you have bulls that go blind due to Pinkeye, they're not out there going to breed cows very well, because they're in pain, and two, they can't see very well, so they could be even more prone to other injuries. So it's one of these ugly diseases that we really deal with in that late spring and early summertime point. And I think the bigger problem with this disease is it's cattle are out on pasture with it. So now we got to go get these infected cattle and bring them in and treat them appropriately. And that can have its own type of issues out there to how we go about treating it. So going back with the disease, it's very seasonally problematic in the beef herds. We also deal with it in the feedlots, but not nearly to the scale that we deal with in the beef herds for reasons. And a lot of times in the feedlot, it's more due to a physical abrasion to that eye or some sort of trauma.
So once we have that abrasion, whatever it causes, what kind of bacteria is settling into this, or is it a mixed bag of bacteria? Or
so there's been a few culprits that we call out there that we identify most commonly. One of those is Moraxella bovis, and its cousin, the bovaculi.
Yep.
And then we also see some mycoplasma species. And I say species because we continue to keep identifying different types of mycoplasmas that are in the affected eyes. It can be one, it can be both, it can be multiple, and that's kind of the ugly head of this disease, is that there's a lot of different potential culprits of the causative infectious agent in the eye.
Yep. So let's take a break. we've got the steer, the cow, the heifer, or whatever set up with Pinkeye. When we come back, we'll talk more about what the clinical signs are and what you'll see in your pastures when you think about Pinkeye and your cow herd. We hope you never see this, but more to come from Dr. Johnson here at Texas Tech right after these messages.
Hello there, Dr. Nick Wagner, Professional Services Veterinarian, and today I wanted to talk about some tips for managing foot baths on your operation. Foot baths are an important piece of personnel movement on and off an operation, and foot baths are something that if they're not appropriately managed can be a concern. So one of the things with foot baths that you should do is try to make sure that you knock off or rinse off the organic matter from boots before you step in the disinfectant, and then allow the disinfectant to have the proper contact time for it to be effective. And then look at disinfectants that may stand up a little better with organic load, because again, if you're not consistently managing these, the organic load in them can cause them to not have the level of efficacy that you may want.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
Hey folks, welcome back to DocTalk. I'm here with Dr. Blaine Johnson, and we're at Texas Tech University in Amarillo, Texas, at the School of Veterinary Medicine, where Dr. Johnson is a bovine veterinarian. His research has been published far and wide. I use it a lot in my day-to-day practice. So I'm very thankful for all the work that you've done and continue to do. But let's talk about what you drive out on the four-wheeler into the pasture to check the calves and the cows, and when we're talking about Pinkeye, what are we going to be looking for?
Yeah, so this is the time of year we're out. We're probably filling our mineral tubs, throwing salt blocks out there, looking at the cattle really well. And then you'll inevitably see that one cow or calf or multiple that are having those really squinty eyes. And that's probably one of the first signs you'll see, between squinting eyes or tears coming out of the eyes, are the other big issues that you'll see early on in this disease process of Pinkeye. Another thing you might see, these cattle tend to hide in the shade more when the sun's out, because if the sun's on those eyes, it becomes very painful. We're looking for pain as the big indicator, pain and teary eyes, and then try to get a good look at those eyes. If they're constantly tearing and constantly squinting, then we know that's something we probably need to evaluate further, and get those animals in and look at them up close to make sure we know what we're dealing with, just in case it's not a one-off that some sort of twig or grass on or something isn't stuck in the eye.
Yep. So we get the animal up, we get up close. Now what are we gonna, as the disease, kind of walk me through how that disease progresses and how you can, because I agree with you that they start out by squinting and watering, and then about a week later we start to see the actual Pinkeye.
Yeah, and this disease can manifest and progress pretty fast. So we have the animal up in the chute. We're going to look at the eye itself in the subconjunctiva, so the pink area around the back of the eye. And what we're looking for is if there's any lesions on the cornea, the outer surface of the eye, and then be more centralized. If we start seeing any lesions like that, that means an ulcer is starting to develop. And the reason that an ulcer is developing is because there's most likely a bacteria that's going to start festering in there. These bacteria have some toxins and stuff that help break down that cornea tissue, and that helps them propagate, and that can be problematic because that can progress even worse to the point where we might even lose the eye if we let it go. So once we look at the eye and we evaluate it and we see that it's a true pink eye or something like that, next step is going to be treating it. You want to treat it with an appropriate antimicrobial typically. And then you might want to give some pain medication, some sort of NSAID to go with that, because it is a very painful disease. We see these animals squinting. They're photophobic. That means they don't like in the sun. They like to get out in the shade. And typically a lot of these animals have a lot of flies around them too, and more in particular face flies. Those are the problematic flies, and those are the ones that like to go right in the corner of the eye and try to drink those tears. And face flies, they're an inevitable part of cattle production. It just seems like they're everywhere, and a lot of things we can do to help prevent those, but inevitably we're probably going to still deal with them at some capacity. So once we see that this is pink eye, you want to get to it and you want to treat early. Try to get that disease stomped out as early as we can, because what I've seen out in practice is once it starts to manifest in a herd, it'll go through a herd, and the earlier you treat, the better the outcome. The later you let that disease progress go, the more likely you might lose vision or have defects in those eyes, which will lead to discounts in the future at weaning cells and stuff like that.
Or blind calf.
Or blind calves.
So let's take a break. When we come back, we're going to talk more about pink eye with Dr. Blaine Johnson here at Texas Tech University.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
I've been a veterinarian since 1987. My wife and I set up a practice in Monette, Missouri in 1989. We started using therapies shortly after it came out. I was overwhelmed with the positive response that we were getting from producers. They could noticeably see a difference. I have to admit that I was pretty skeptical at first. I am currently 110% sold on the product. There is no doubt in my mind that this is an added product that we can use on these cattle that is going to make a significant difference.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Blaine Johnson. We're at Texas Tech, where he's a bovine veterinarian, one of the best, and we're tickled to death to have him take time out here at the School of Veterinary Medicine to spend with us and share his knowledge on pink eye. Just kind of go through the nuts and bolts, or the ABCs of the treatment, and also touch on covering that eye.
Yeah. So pink eye, we typically see it late spring, early summer, and we bring the animals in and we decide that it is pink eye, and now we need to treat it. So we're going to treat it with some sort of systemic antimicrobial. I like to pick the ones that are labeled for that disease treatment. There's a few out there to pick from. And then the next thing I like to do is get some sort of coverage over the eye, get the UV light off the eye, because that's going to help it heal faster, in my opinion, from what I've seen out in the field as well. So whether that's either you're putting some sort of patch that you can buy from a veterinary supply store, or my favorite is you have a bunch of old pairs of jeans that you just cut holes out of to cover up the eye and put a little bit of glue on that.
Yep.
That glue will hold on for about 10 to 14 days and fall off. Yes, the animal may not be able to see too well out of that eye or at all, but getting the sunlight and getting those flies off of that eye are very paramount to get that eye to heal quick. And that's the beauty with the eye itself, is that cornea can heal very quick once it's given the appropriate conditions to heal within. So you can have good resolution as long as you're getting to the disease process early. Once we get to an advanced process of that disease, so we're starting to see that eye bulge out, or we're starting to see a really bad ulcer or vascularization around the eye, and it's to the point where it almost looks like it's a balloon about to pop.
Yep.
That might take a little bit more advanced veterinary treatment, where they either have to remove the eye or some tissue in the eye to get that eye to actually heal appropriately. It's not something we like to do, but it's to the point where it's necessary for the animal at that point. So that's where you really need the veterinarian to come in and play their role and treat that eye appropriately, whatever they diagnose if it's an advanced case. Those animals do well on the other end. They can do okay with one eye, or if they get that eye removed and closed, they'll perform just as well as the rest of their groups. It might be discounted a little bit because they have one eye less, but nonetheless, they will start producing well again after that and go back to eating grass.
You bet. You bet. Well, like anything, good early treatment, work with your veterinarian, have a good protocol put in place, and these are very treatable diseases. Let's start talk a little bit about prevention.
Yeah, and that's probably where we get the best bang for our buck is start thinking about preventative strategies that we can implement. And where I like to start is in the nutrition aspect.
Yep.
So, I mean, cows are herbivores, they're out on grass, but they do require supplementation while they're out on grass. And what I mean by supplementation is that mineral and salt. You want to get a very good mineral pack in front of your cows, because as long as they have enough adequate minerals and vitamins out there, that then they have that nutritionist foundation that'll help them keep this disease at bay. So that's step one.
Yep.
And you want to implement that early on. And honestly, you should probably keep a good mineral nutrition year round, not just during the grazing state.
Right.
Next thing you need to start thinking about is the grass itself. We start seeing this problem arise more in the later spring, earlier summer, depending on where you are geographically. And that's what I mean is the grass starts getting taller, and that's where it becomes a physical irritant. You start having pollen start to come out into the air. You're having grass seeds starting to fall around. So cattle are reaching down for that grass and potentially irritating that eye. So we want to start looking at the fields. Do we need to move herds more strategically around a pasture so if there's areas that if overgrowth, then we put more animals in there that they stomp that down, graze that down more appropriately? Yep. Or do we need to go in and actually mow that field or something like that to keep that from irritating the eye?
Yep. Let's take a break. When we come back, we'll wrap up with Dr. Johnson on prevention in Pinkeye. It's been a great show. Still a little more to learn. We'll be right back.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Blaine Johnson. We're at Texas Tech School of Veterinary Medicine, where Dr. Johnson is a veterinarian, works with cattle, all different areas of production. He also is a professor here at Texas Tech University, serving in the classroom, serving in the clinical skills, and serving with research. Just a wealth of information. And so loved minerals. Gosh darn it, you turn those cows out and you see that pollen bust of all of them going into that beautiful pasture that we hadn't had anything all year. And I just start going, oh no. That thought in my mind of it's something that's going to scratch that cornea or something that's going to cause the irritation and set up an infection. But you've covered that on mowing, keeping things grazed down, doing the best that we can to see what's going to come. But what else are some things? Flies, I'm sure.
Flies are the next place we try to combat. And there's a lot of different strategies to go out on how to combat flies. So we have things that we can put in the mineral or into their feed called insect growth regulators. And that kind of, if you get that in, the problem with that is you need to get it in early enough so we're not getting into that fly season, because it actually affects those larvae and it keeps them from maturing out and becoming flies and propagating and going over again. So that's something you need to implement earlier on in the process. So start thinking about that in March and April, not April, May, June, because then it's too late and you're just kind of throwing money around. It'll help to some extent, but not as where you really want it. And you need to keep that going while it's earlier on in the grazing system. Other flies are problems out there, but thankfully we can do things such as dusters, fly tags. We can do some pour-ons too. The thing with that is you need to be able to constantly apply that, because it's not we apply it once in the spring, see you next fall kind of treatment. It's they have a longevity to them. There's environmental breakdowns to these pesticides. So if it's something that we're doing a pour-on or a fogger or a mist or something like that, it needs to be reapplied every 2-3 weeks, depending on how much sunlight's being exposed to these animals, because that's what really breaks those down the most. Or if it's a duster, you want to make sure that it's being adequately evaluated constantly, that it's not ever empty for an extended period of time. Or if it's fly tags, they have a lifespan of their own. You want to make sure if we like fly tags, we need to reapply those some point in this grazing period, because they run out of their effective lifespan at some point. Very good and when they're applied appropriately, but they're not a magic bullet to cure all for the whole grazing system. So it's something that it's a continual battle, not just a one point in time battle.
Yeah, and when it says 2 fly tags per cow, don't cheap out and do one. Put them both in there. But you're right. A lot of times we're doing our turnout vaccination and pre-breeding, and we put the fly tags in then, and they run out of juice by the time we really need them.
Yeah, it's true. We're putting those in like April, early May, and the flies are becoming very problematic June-ish, late June, early July, and those fly tags have kind of petered out by that point.
Yeah, and I've talked about the vaccines against Pinkeye, and they still haven't come up with a vaccine against a scratch in the eye.
No, they really haven't. That's something we need to probably do some more research on. And that's one thing to include too, is in your vaccine program, a lot of different vaccines available, from commercial to autogenous, and that's something you really need to work with your veterinarian on to figure out what is best for your herd on a vaccine protocol.
At the end of the day, keeping the cows healthy, keeping them vaccinated for all diseases, IBR, BVD, everything that just a good, solid herd health program, and looking out for these preventative things such as flies and weeds is important.
Yes, it's a multifactorial approach at this. It's not a silver bullet. So there's a lot of different avenues we need to address in combating pinkeye.
It's awesome. Thanks for being on the show.
Thanks for having me.
Thanks for watching the show. Remember, if you want to learn more about what we do at DocTalk, you can find us at www.doctalktv.com. Always work with your local veterinarian. And with Dr. Blaine Johnson, I'm Dr. Dan Thompson here from Amarillo, Texas, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
Hello there, Dr. Nick Wagner, Professional Services Veterinarian with Neogen, and today I wanted to talk about what it entails to select the proper chemistry from a disinfectant standpoint. So one of the first things you want to make sure that you're doing is selecting an EPA-registered product. You want to look at the active ingredients, and some of the common classes of disinfectants that are out there are quaternary ammonias, phenols or phenolics, oxidizing compounds, a special segment of oxidizing compounds, the halogens, the aldehydes, acids, and alcohols are some of the common chemistry classes that are out there. But what it comes down to is look at the active ingredient. You also then want to look at efficacy, because you want a disinfectant that's broad spectrum, that's going to take care of all the pathogens of concern for your operation. Then you want to look at, okay, what's the dilution rate for the product? What's the contact time for that product? How does that product hold up with regard to organic load or water hardness? And then one of the other big things is making sure you understand the safety profile of the product and the necessary personal protective equipment for your personnel when they're applying the product. And then the last thing is economics does factor into those decisions as well. But really what it boils down to is you want to be able to ensure that you're using a product that's going to be efficacious against all the pathogens of concern, but yet is safe from the standpoint of your personnel applying it and being able to mitigate those concerns for your operation.
Thanks for watching Cattle Intel by Neogen.